All right, so liver hemangiomas. This is number one benign pathology. So let's take a look at what this very, very common pathology looks like. So first we got to know what else can we call liver hemangiomas. So we can call them hepatic hemangiomas, makes sense. Medical term for liver is hepatic. And we can also call them cavernous hemangiomas. Not as obvious that this is talking about a liver hemangioma, but they are called quite commonly cavernous hemangiomas. So remember that other term. And what are they? Well, quite simply, they are just a mass of tangled blood vessels. Like I said, this was the number one benign liver mass. Remember that. What's the most common? Liver hemangiomas. And this affects about 5% of the population, and I would 100% agree with that. Maybe would even argue that it's more than that, because it seems like I'm seeing hemangioma, I would say at least once a month when I'm scanning patients. And we actually quite often find these on students when we're scanning in class. So again, very, very common finding in ultrasound. It's more likely going to affect females that are somewhere in that 30 to 50-year-old range. Because they're not very significant as far as prognosis or treatment, because you're not going to do anything for them, really all we need to know then is what do they look like by ultrasound. So hemangiomas are very particular in the way that they appear. And as you can see from this picture, the hemangioma is very echogenic compared to the normal liver parenchyma. What we can also see then off of this picture of the hemangioma is a little bit of edge shadow. Typically, the hemangioma itself doesn't create much of a shadow, but an artifact that might pop up off of it is that edge shadow. Now here's an abnormal appearance of a liver hemangioma, and that's because this liver hemangioma is in the setting of fatty liver. So now this hemangioma is actually a little bit darker than the rest of the liver parenchyma. If this hemangioma was seen in the setting of a normal liver, then we would get that typical hyperechoic appearance. So here we're back to more of our classic appearance of liver hemangiomas. They can be singular or multiple. And what I have seen is that they really like to hang out more towards the edge of the liver. So as a sonographer, you've really got to make sure that you're going up and down, left to right, really checking out every inch of the organs that you are evaluating. Now you might be surprised to find out that when we put color on hemangiomas, they actually don't light up. Earlier I just said they're a tangled ball of blood vessels. What they actually are, and they are a tangled ball of blood vessels, but they are like itty bitty tiny blood vessels that are all intertwined, all connected, and they just don't really have any visible blood flow to the ultrasound machine. So if we put color on them, we might see some peripheral blood flow, but typically not any color on the inside. All right, so don't forget to check out the comments and be sure to put your input in on how you would describe hepatic hemangiomas using sonographic terms.